Hello, viewers around the globe. This is Dr. Afshan Hashmi, your best selling author, radio, and TV personality in her Glam and Glitzy book club. The book I am going to review today is this one, COVID, The Politics of Fear and the Power of Science by Marc Siegel. So, this is the book and it is on my Kindle. But before starting the review, I would like to remind you that have you bought my first book, The Modern Mughal Mentality, New Strategies to Succeed in India and the Global Marketplace, and my second book, The Outbreak of a Monstrous Infection. My first book, friends, was about Hindi buzzword jugaad, which I conceptualize as thinking outside the box, and I have designed a business model in this. And if you follow my mantra, you will be very successful in your business. And my second book was about bioterrorism, and it is a science fiction story, a very unique story. And when this book came in 2019, there was no trace of coronavirus, and these two books were bestsellers on Amazon. So if you haven't bought these two books, please go and buy these two books and give me an honest review. Having said that, friends, today I will, as I said, I will review The Politics of Fear and the Power of Science by Marc Siegel. And this is the cover of the book, and it is on my Kindle. So, first, I will read about the book. Separating fact from fiction in the COVID 19 epidemic, people are afraid COVID 19 has upended our lives as it poses new medical dangers, economic suffering, and grave uncertainty about the world around us. The collateral damage is enormous, but politics invade perception. There are so many unknowns. Does a treatment work? Is a vaccine coming? How likely are you to catch COVID? And how can you best protect yourself and your family? What are the real risks and what is hysteria? Where are our fear leaders? What are their agendas? From Fox News medical contributor and the author of False Alarm comes COVID, The Politics of Fear and the Power of Science by Marc Siegel, MD. This shocking expose of the fact that the media covers the national pandemic news and spread of the invisible virus reinforces the notion that we must arm ourselves against fear tactics that limit our abilities to safely make decisions and protect our families in a world of uncertainty. Life for citizens of the developed world before the pandemic was safer, easier, and healthier than for any other people in history, thanks to modern medicine, science, technology, and intelligence. But COVID 19 has stolen that security and our nation's peace of mind. Now there is a pandemic virus as well as a crippling epidemic of fear sweeping America. Why? The answer, according to nationally renowned health commentator Dr. Marc Siegel, is that we already lived in an artificially created culture of fear that was just waiting to be unleashed. In COVID, the politics of fear and the power of science, Siegel identifies three major catalysts of the culture of fear: government, the media, and our own psyche, with fascinating blow by blow analysis of the most sensational false alarms of the past few years, compounded now by the worst contagion of our lifetimes. He shows how fear mongers manipulate our most primitive instincts, often without our even realizing it. COVID shows us how to look behind the hype and hysteria, inoculate ourselves against these crippling fear tactics, and develop the emotional and intellectual skills needed to take back our lives even as we battle the pandemic itself. About Dr. Marc Siegel. Marc Siegel, MD, is a leading medical expert on the global COVID 19 pandemic and the chief medical analyst for Fox News. President Donald Trump, in an exclusive interview, calls Dr. Siegel one of his primary guides to the COVID 19 pandemic. Dr. Siegel is a member of the board of contributors at USA Today, a columnist for The Hill, a contributor to the Wall Street Journal, a clinical professor of medicine at NYU Langone Health, and the medical director for Doctor Radio on Sirius XM. Dr. Siegel is also the author of False Alarm: The Truth About the Epidemic of Fear, The Inner Pulse, Unlocking the Secret Code of Sickness and Health, the novel Bellevue, as well as other books on flu. With over 30 years of experience in the medical field, Dr. Siegel has written extensively on health outbreaks and pandemics. So, friends, this was about Dr. Siegel, and now let me read some editorial reviews which I got from Amazon, this book's web page. Editorial review. Marc Siegel is the first person we go to when we have got questions about medicine and science. This is the first book I had read about COVID. Tucker Carlson, national broadcaster and best selling author. Dr. Marc Siegel is the nation's doctor when it comes to expertly addressing the pandemic. Mark Levin, national broadcaster and best-selling author. Praise for Dr. Marc Siegel. Dr. Siegel, always good to talk with you, especially at a difficult time when we need to get the facts out to the American people. We talk about a pandemic of virus, but you and I also always talk about the fact that there is a pandemic of misinformation out there. Thank you for the work that you have done to help people better understand a disease that quite frankly changes and humbles us each and every day. Jeremy Adams, MD, MPH, Surgeon General of the United States. I just want to thank you, Dr. Siegel. You have played a really important role in helping to educate the American public with really balanced scientific, factual information, and that's very important. Alex Azar, United States Secretary of Health and Human Services. Thank you for all you do. It is such an important role you play in getting the information out and getting it out accurately and motivating both our own professional physicians but the public at large to enhance these important public health measures, particularly vaccination. Robert Redfield, MD, Director of the Centers for Disease Control and Prevention. Siegel cuts through the hype about the deadly this and the lethal that and applies reason in seeking the answers. John M. Barry, author of The Great Influenza, the epic story of the deadliest plague in history. Marc Siegel is an articulate voice of reason in a world beset by hype and hysteria. We would be well advised to listen closely to what he has to say. Jeremy Groupman, MD, staff writer, The New Yorker. You have really been the model for health education nationally. Martin Adel McCary, MD, MPH, professor of surgery at Johns Hopkins Medicine and best-selling author. Dr. Siegel is a straight shooter here. You are not going to mix your words. You are not going to pull your punches. It is what is it? And I think it's great form to get the public health messages out. Brett Greer, MD, Assistant Secretary of Health. And now I watch you all the time. You are like my guide to this because, frankly, you really have a good take on it. You know how important it is. President Donald Trump on Dr. Marc Siegel. Now, as you know, I always read two Amazon reviews which I like, and here I go. Amazon review number one. I am a fan of Dr. Siegel and ordered this book 10 minutes after he was interviewed by Mark Levin in October. The book I hoped to read would have been informative with details on timelines and who slash what of the major pandemics of the past 100 years. That is not this book. The first five chapters are about fear and interesting plus educational. It had little to do with pandemic. The coverage on the pandemics from 1918, 1957, 1968, 76 were building my hopes. Not loads of details, but I learned some new things. The 2009 H1N1 event was better covered, but still not as detailed as hoped. Lots of Obama questions missed. Ebola in 2012 got limited coverage. The COVID coverage was then quite disappointing in lack of details. Lots of focus on fear, not as much perhaps on the decisions and impacts on the timeline. Honestly, the conclusion was the best summary of the entire COVID topic, well written. Actually, there is a lack of good editing from about chapter 6 onward. Wrong words, missing letters, missing spaces between words, very rush to press. Would I recommend this book? Maybe if someone had no awareness of any pandemic over the past 100 years and no awareness of politics, then this could be insightful for you. Now I read the Amazon review number two, which I liked. I had high hopes for this book as I enjoy hearing Dr. Siegel on TV. The title implied content that I wanted to learn more about, and I did gain a number of insights from the read, but it was an arduous read. The paragraphs don't flow together well, and there is a considerable amount of repetition. To make matters worse, it seems there was little, if any, proofreading done before releasing the book. Grammatical errors, misspellings, and words out of sequence appear on practically every page. If the book were cleaned up to fix these errors, I would give it a couple more stars. And now, before giving my review, I would like to read from the book so that you people who are seeing this review can understand what this book is about. So the book is COVID: The Politics of Fear and the Power of Science by Marc Siegel, MD. So this is the book. So let me read little bit of preface. On the 27th of January 2020, I warned my TV viewers about a virus that had originated in Wuhan and spread to several other countries, with five reported cases in the United States at the time. I have been studying contagions for a really long time and I have never seen anything like this, I said at the time. The Chinese government was reporting that at least 106 deaths had been attributed to the coronavirus, with more than 4,500 confirmed cases in the country. The State Department urged Americans to reconsider traveling to Wuhan and ordered all non emergency U.S. personnel and their families to leave China immediately. I called China's delay in imposing quarantines and travel travel restrictions reckless and really, really scary, and indicated that I felt that the actual number of cases in China was far greater than was being reported. I also brought into question the role of the World Health Organization in obscuring the truth about the emerging pandemic and irresponsibly calling it a regional problem only. Unfortunately, the information coming out of China proved to be unreliable and in many cases inaccurate. So this was little bit about the preface. Let me read little bit about the, from the introduction, and here I go. This book was originally conceived almost 20 years ago unexpectedly during a southbound trip on the FDR Drive in New York City on the morning of September 11, 2001. It was a bright hot morning when I began to notice the multicolored ambulances from all over the city: Columbia, Presbyterian, Metropolitan, St. Vincent's traveling alongside and passing me, all exiting at Bellevue Hospital. I volunteered my services to the transforming emergency center at Bellevue that morning, observing the rush of human emotion, at once committed to the task and yet frightened. The fact that ultimately there weren't the survivors to fill our beds did little to stem the fright. People worked to keep their minds off the unfolding disaster, and this I discovered was a necessary coping strategy. As I volunteered my services to the Red Cross and to my patients in the succeeding months, I discovered a new found vulnerability. I entered the media world and found that each healthcare topic I discussed in an article or on TV seems blown out of proportion to the real danger. I seized the chance to learn about each succeeding bug to jar and to try to offer perspective and a salve of reassurance whenever I could. We all personalized 9/11, and it made us all feel more at risk. Whether we were really at risk or not, we grew afraid more easily than before, misinformed by our leaders and provoked by the news media. We have never been the same since. Anthrax was the first manifestation in concrete terms of this personalized susceptibility. I was honored to participate in a U.S. Senate investigation into the handling of the anthrax crisis directed by Senator Chuck Grassley of Iowa. I discovered amidst the CDC and U.S. Postal Service papers and letters to and from the senator, a sense of fumbling. Fear out of proportion to the real risk was made worse by a lack of preparedness. So this was little bit about from the introduction. And then there is part one, pre-COVID. Fight for or flight. We cannot wait while dangers gather. Condoleezza Rice, then National Security Advisor, addressing the 9/11 Commission on April 8, 2004. Why are we so afraid? Fear has been with humankind from the beginning and is part of our psychological makeup from birth. Our earliest fears are tied to mommy disappearing even for an instant, taking away our only comfort and protection. Children are afraid of the unknown. It is only as they develop that they learn to distinguish a sense of global uncertainty from a specific danger. As we become adults, our fears are tied to specific threats and association that distinguishes fear from anxiety. Anxiety can be self perpetuating as it often originates in neurosis or self doubt. Anxious people worry when they don't need to. Fear, on the other hand, is meant to be an essential tool. We have inherited the fear apparatus practically unchanged from our animal forebears, but we often allow it to generate self defeating hysteria. When fear is unremitting, especially when it is constantly provoked but no protective action can be taken, anxiety and hysteria often result. You are absolutely fine, I said to my patient who couldn't catch her breath. No, I am not, she insisted, coughing and wheezing. It was only when she told me that her wedding was the following weekend that I saw her fear turning to anxiety and decided to forego an extensive lung workup. So this was little bit from this chapter. Now let me go to another chapter and see. It works for animals but not for us. Take a rat and put it in a cage with a plexiglass divider. It sees the cat on the other side. It's afraid it's going to be attacked. The associated fear is very difficult to extinguish even with the plexiglass there. Asta Sabin, professor and graduate program director, Department of Biochemistry and Molecular Biology, New York Medical College. When a patient is restrained inside a magnetic resonance imaging MRI machine during a scan of the brain, his head is strapped down and his body is enclosed in a coffin like chamber. A loud metallic banging sound is heard, and the patient, like a restrained animal, may feel like he is never going to be released. The claustrophobia combines with the loud banging to cause an escalating fear. Even worse is the terror some women feel when undergoing a mammogram. One of my patients described what it's like to wait while her breast has been painfully flattened to a pancake by the pressure of the equipment. I have the awful fantasy, she said, that the technician will die of a sudden heart attack or there will be a power outrage and my breast won't be released. A patient's instinct is to fight her confinement even when she knows it is for her own good. So this was little bit from this chapter. Our culture of worry. What an appealing affront to share the intense desire for continued existence with all living things, but be smart enough to recognize the ultimate futility of this most basic biological imperative. We think that clash creates the potential for terror. Tom Pyszczynski, professor of psychology at the University of Colorado and co-founder of terror management theory. Animals may fear death as much as we do, but whereas animals freeze in the face of immediate danger, we experience an ongoing existential fear connected to our unique self-awareness. Our central fear of death reaches beyond our animal instincts and may threaten to overwhelm us. But like all of our fears, our fear of death is overblown when we are wrongly convinced that death is in the offing. Our fear of death is so pervasive, it is too easily provoked. At the New School University Fear Conference back in 2004, Dr. Tom Pyszczynski, a rumble jacketed professor with flowing white hair, was a striking contrast to the balding, impeccably dressed Ludok. Pyszczynski was one of the originators of terror management theory, and he described how all fear emanates from a primary fear of death. Fear is supposed to function to keep us alive and help us stave off death as an unpleasant emotion. It creates a barrier we are not supposed to cross. Dr. John Mann, currently a professor of translational neuroscience at Columbia University and the director of molecular imaging and neuropathology at the New York State Psychiatric Institute, is an expert on suicide. In an interview, he said that even in the most extreme cases, fear of death is designed to have a protective aspect take away this fear inhibition, and the person is no longer indecisive, and suicide may ensure. So this was little bit from the book, friends. So now I will give my insights into the book, my review. And my review is here, and I go now. I'll read anything about COVID-19 virus, so I wasn't sure what to expect from the Fox News doctor, but I liked the book. As a scientist myself who knows about virus and how they operate, it's good to hear a streamlined thought process in the book before taking care of hysteria and then put things into perspective. Highly recommended. Give it 5 stars. So this was my review, and friends, I just wanted to remind you that have you bought my these two books, The Modern Mughal Mentality, New Strategies to Succeed in India and the Global Marketplace, and The Outbreak of a Monstrous Infection. These two books were Amazon bestsellers. If you haven't bought these two books, please go and buy these two books and give me an honest review. These two books are in Nook, in Kindle, in paperback, and in audiobooks. And I have narrated my audiobooks. And if you have those kind of needs for audiobooks narration or production, then please contact me at Afshan at drafshanhashmi.com, and go to my website www.afshanhashmi.com and see what kind of services I run. Having said that, friends, now I close this book club meeting, and cheers. And this is your loving host, Dr. Afshan Hashmi, now signing off from this book club meeting. And cheers and bye bye.